Hi, I'm Kate Oren with Devex, and we are taking a short break from the program for a conversation in partnership with the Pfizer Foundation on how data innovations are helping overcome last mile health access challenges. And I'm joined by Freddy Nkosi, who is Senior Director for West and Central Africa at VillageReach, an organization working to strengthen health systems so they reach people wherever they are. So, Freddy, thank you so much for joining me.
Thank you, Kate, for inviting me and giving me this great opportunity to talk about the work VillageReach does, but most importantly, the work we have been able to accomplish through the generous contribution from Pfizer Foundation.
Great. So when we talk about the last mile challenge, we're often referring to the gap between national level progress and what communities actually experience. And from where you sit, what does that gap look like on the ground, and what approaches work best in closing it?
Yeah, thanks, Kate, once again. This is an important question because when we talk about the last mile challenge, we are really talking about the difference between progress that is visible at the national level and the reality the families, health workers, communities are experiencing day to day. A country it can have vaccines in the national system, a strong immunization strategy, an ambitious coverage target, but a child can still remain unreached if the vaccine is not available at the service delivery point. What we always say at VillageReach, if the vaccine is not available, when and where is needed. And the child can also miss the vaccination session only because it's canceled or if the health workers does not have the right data or if the community has not been engaged in a way that respond to its reality. In our context, this gap has both supply and demand dimensions, but I will emphasize that these are system issues, especially when we are talking about the sub-Saharan Africa, where we see some trends in many countries where VillageReach work. So some children are zero dose only because vaccines or vaccination supplies are not available when needed. Some are missed because the session planning is not adapted to the geography, to the season, because the population in the countries where we work, depending whether it's a dry season or wet season, can cause a population to move. And if the health systems does not adapt to the change of the system, that could also cause some children being or missing their vaccination session. But it could also be the transport a constraint or the daily responsibility of the caregivers. Mothers and families may miss appointments, but that should not be framed as their responsibility alone. Often, the system has not made services closer enough or reliable enough or responsive enough for their lives. We have seen through the activities we are organizing, some mothers, they are not just able to walk 20 kilometers from their farms areas to the health facilities because it's not only 20 kilometers, but they need to climb mountains, across the rivers. That's making accessibility very challenging and the distance almost impossible for the mothers to go and bring their children to the health facilities. This is why local leadership matters.
Great. Well, thank you, Freddy. And you mentioned the kind of data challenges, and VillageReach is known for data informed, locally led approaches, as you illustrated. Could you share an example of an innovative use of data that has help empower local decision makers to improve access to vaccines or other essential health services?
A good example, I've got so many examples that I can give, but a good one is our work to strengthen vaccine supply chain and data use through the next generation of supply chain that I spoke about in DRC and in Cameroon. The challenge was not simply that data did not exist. In many cases, the data exists, uh, but the system, such as the district health information system software that we call DHS2, did not present the data in a way that the health workers can read, understand easily, and make a timely decision. For example, if a health zone or health district manager cannot easily see which facility have low vaccine stock or stock out, which antigen are at risk of stock out, or where zero dose children are concentrated, the decision, and I can tell you, will be delayed. That can mean a vaccination session is planned without any reliable data to address the issue of zero dose children or under immunized children where they live. So, through the generous contribution from the Pfizer Foundation in Cameroon and in DRC, we have been able to partner with the government to improve the recording and sharing and presentation of logistic data in a way that the health workers can easily understand to make a timely decision.
Well, Freddie, thank you so much for sharing all of these examples of how you can bridge the last mile to ensure health services reach everyone everywhere. And thank you to the Pfizer Foundation. And stay tuned to future episodes for more in this series highlighting how innovation is transforming health systems. Thank you again.